Hi, I'm Dr. Meredith Warner of Warner Orthopedics and Wellness in Baton Rouge, Louisiana. And I am a practicing orthopedic surgeon, so obviously see and treat a lot of joint pain. What is joint pain, or what is arthritis, would be a more apropos question, which is what we're going to talk about today, because I want to discuss how turmeric or curcumin can really help with your arthritis pain. So this is a knee. This is probably the most prevalent joint in terms of complaints of knee pain or arthritis, okay? All arthritis is when the smooth coating of any given bone that moves relative to another bone, so here you've got the thigh bone and the shin bone, or the femur and the tibia, the smooth coating that allows that sort of friction-free movement of your joints is cartilage, okay? And when cartilage gets damaged or pitted, rivets in it, frayed, rough, or even disappears, and you have what's called bone-on-bone arthritis, that's when you have pain from arthritis. Now, the pain from arthritis, interestingly, is not really from the damaged cartilage, but rather from inflammation. So it is now pretty generally accepted in the scientific community that most pain can be attributed to the cytokines. These are small proteins that are pro-inflammatory and that induce catabolism or destruction of things rather than anabolism or building up. So they're catabolic and then they're inflammatory and pro-inflammatory in terms of damage and destruction of cell membranes, releasing lysosomes filled with neutrophils and exudative or bursts of oxidative stress. Generally, inflammation you can think of as a way to treat a pathogen. Like, let's say you catch a cold, you need to have inflammation to fight off the cold. But when you start attacking yourself with cytokines, particularly your joints, with arthritis, that's when you start having trouble. So curcumin can modulate this, or turmeric. What it can do, it actually changes a pathway that is induced in arthritis or induced with the genetics or the dietary problems that we have in our country, or the pollution, or even we'll say injury or trauma, right? A lot of these pathways are common in that they end up with an increased amount of cytokines. One of these is the nuclear factor kappa beta pathway. It actually induces the genes in your chondrocytes and in the cartilage and in the synovial lining around the joint and then the connective tissue. It actually induces the genes to produce more inflammatory cytokines, or call more in, which induces more damage. So if you can stop inflammation of the nuclear factor kappa beta pathway, that is an awesome way to treat arthritis. And that's what natural medicines do. So when you think of things like Celebrex or ibuprofen or Aleve, those kind of medicines that you take when you hurt, those are stopping a part of the arachidonic acid pathway, and they sort of just modulate prostaglandin production. But if you really want to get to the heart of production of cytokines like tumor necrosis factor, interleukin 6, interleukin 8, what have you, you need to go to the NFKB, or the nuclear factor kappa beta pathway, which is a little bit different. And that's how many of these natural medicines work. So curcumin will decrease activation of the NFKB pathway, as do many spices and herbs, to include ginger, which in a joint health multi, I find the combination of curcumin and ginger together is pretty efficacious, and actually they're both from the same sort of plant family, so that makes sense. Anyway, if you take curcumin and you modulate inflammation of the NFKB pathway, then any drugs you're taking to modulate inflammation on the arachidonic acid pathway will be more effective. And the NIH has actually looked at this, as have a lot of scientists in clinical studies. Basically, you could use turmeric or curcumin, if you're taking Celebrex, for example, currently for knee arthritis, to either reduce the amount of Celebrex you take or how often you take it. It'll actually make it work better for you because of the synergistic effects. So curcumin is anti-catabolic. It decreases the production of enzymes that damage cartilage. So these are called degrading enzymes. So curcumin can modulate the production of those, again, by modulating the NFKB pathway. And then it reduces the production of cytokines that are damaging and pro-inflammatory, also by modulating that pathway. And then another beautiful thing about curcumin is it actually really dramatically reduces inflammation in the gut, and it's gut protective. So we know most non-steroidal anti-inflammatory drugs, the synthetic drugs that you get prescribed, damage the gut biome, cause gastric bleeds, cause a whole host of problems to the intestines, and a lot of people with things like Crohn's disease can't even take them. But curcumin is actually used to treat things like Crohn's disease, and as sort of a stabilizer of the gut biome and to make the mucosa work better. So again, curcumin could potentially be beneficial if you're already on some of these anti-inflammatory meds. You should talk to your physician about this, but I'm a huge believer in turmeric or curcumin to protect cartilage from pro-inflammatory cytokines, to protect cartilage from degradative enzymes, and to allow cartilage its best chance to heal itself. So if you have arthritis, you should strongly consider turmeric as part of your regimen.